In 2014, the Family and Child Welfare Policy was launched. It was primarily to promote the well-being of children by ensuring safety and protection from harm, achieving permanency and strengthening families as well to care for their children successfully was part of it. Now, 5 years on, the Gender Center at Gimpa says they have identified some gaps in the implementation of that policy, resulting in the neglect and abuse of children. We'll speak to members of the team from Gimpa, but first, here is a report put together by Hannah Odami.
The policy expected to promote the well-being of children, prevent abuse, neglect, exploitation and harm was to be implemented through child and family welfare programs as well as activities. 5 years on, the Gender Center at the Ghana Institute of Management and Public Administration, GIMPA, says some monitoring and implementation gaps have been identified, accounting for the many child abuse cases being recorded in the country. Dr. Beatrice Ikuya-Sichua is coordinator of the Gender Center at GIMPA.
We've seen some gaps, and the gaps basically are the violence happening, and yet there is a policy that protects families and children, and the policies seem not to protect them from that perspective.
A lecturer in gender expert at the center, Dr. Giftuforiwa Jamera, mentioned in particular how worrying it is, the yearly increase in defilement cases and how perpetrators are often left off the hook.
Normally, most of these cases are settled in the communities, in the churches. At the community level, that's where they try to address it, emphasizing forgiveness, emphasizing compensation, emphasizing reconciliation, but they hardly think about a punishment or sanctions for the offender.
Founder of Health Support Foundation, James Gawu, was not happy the policy does not include needs of special children.
I would like to see a concerted effort by government, preferably put in the Ministry of Health under this policy that ensures significant protection for children with special needs in the area of feeding, the area of their education, and also their education should have an end plan. Their education, they should have proper assessment of their education.
The Gender Ministry had this response for him.
We couldn't have brought every vulnerable group in there. That's why we say child. Once you fall within the category, it covers you.
The children whom this policy is expected to benefit raise concerns with how it has been implemented.
They should create kind of awareness or something, let's say a section or an article that will deal with how to report such cases, which will not directly go to the police stations, but let's say a commission in the area who will deal with such cases.
We've seen the draft, we've seen the measures, but what are they doing? We want to see what they are doing. Are they going around schools talking about it? Is sex education actually happening? Are the children actually knowing what is going on? How do they protect themselves?
Schools, hospitals, community centers, these small decentralized groups should have certain things in place to help check whether children are being abused, whether the family unit is doing okay, certain evaluations, be it psychological or physical.
Hannah.
Well, you've seen that story there and all of the issues that it highlights. So we'll be having a conversation about families and, of course, abuse of children right after this break. Do stay. Welcome back, and we're going to start this conversation about family. Well, I told you earlier, and you saw in that report, how in 2014, Ghana launched its family and child welfare policy, but how some lecturers have identified certain gaps in that particular policy. I have two of them here in the studio, and we'll be talking about it. We also have a teenager who has seen this, policy and thinks that it doesn't really address the concerns that he has as a Ghanaian teenager growing up. We'll talk to him as well, and then we'll have a very big conversation. on this. Let me introduce to you who I have here in the studio, Dr. Gifty Jamra. She's a lecturer at GIMPA and a gender expert. Dr. Jamra, you're welcome.
Thank you very much.
I also have here in the studio Dr. Beatrice Ekwia-Sechua. She's coordinator of the GIMPA Gender Center. You're welcome, ma'am.
Thank you very much.
Okay, so let's start this conversation. You've seen the reports that Hannah Odami put together. I'm going to start with you to tell us what these gaps that you've identified in the policy are. I don't know which of you is best to answer this particular question,
Okay.
but I believe it's you.
Sure, I think I'll pick that up.
Okay.
I may have to, first and foremost, maybe take this opportunity to thank Busak, who actually supported us to be able to put a program we did 3 days ago together. They financially supported us to do that. The problem with the policy as we have identified, and may I also just go back a little step to say that this program we did 3 days ago, which has brought us here, started from a research we did on child pregnancy.
On child pregnancy?
Within a suburb in Accra.
Okay.
And this, we noticed a whole lot of things that affect the children coming from relationship with family.
Okay.
And other issues that prompt them to have sex, which also make them drop out of school.
Okay.
And we know that the moment a child is dropped out of school, it creates other problems. And so we've done other series of events from that perspective, which brought us to looking into what is happening within the policy, because we noticed that for any tangible changes to be made, we need to go back and check the policy where everything is put.
Which is why, what took you to the policy?
Which is what brought us into looking at the family and child welfare policy.
Okay, okay.
Because reading the objectives of the policy, it says, and I read it from here, it is designed to promote programs and activities that effectively prevent and protect children from all forms of violence, abuse, neglect, and exploitation.
Okay.
To ensure effective coordination of the child and family welfare system at all levels. To empower children and families to better understand abusive situations and make choices to prevent and respond to situations of risk.
Okay.
This is what is set out to do.
But you're saying that there are gaps in there.
That's right.
Would you tell us about these gaps?
Even the objective itself speaks of the gaps.
What point us to it, because I can't see it because I'm not an expert.
I am pointing you to it. This is the objective: to support families and children to protect themselves and to better understand situations of abuse so that they can be protected. Now, when we take child pregnancy, for instance, I am saying that child pregnancy is abuse to the girl child. The situation that prompts them to have sex is in itself abusive. If a parent is not able to look after their children, and if the child will give in to sex and take as little as 2 cedis because they are hungry, and so they need to eat, so they will give in to having sex so that they'll be given 2 cedis.
But that's a social problem, isn't it? That's a social problem.
There is a policy that says we are preventing you from entering into these abusive scenarios. Yet, even though the policy is there and the policy is launched to be implemented, yes, we see children fall into this abusive situation.
So, what for you? What do you want what do you want to see in this policy that is not there?
I am coming. There's another point I want to raise. The point of coordinating to ensure effective coordination of the child and family welfare system at all levels. As it stands now, there is no coordination within the systems. So we have the social welfare services, the department, we have the police, DOVSU, we have other units that must work together. They must coordinate activities together. At the moment, that is not the case. Okay. If something happens, for instance, and the police go to maybe pick up a child, they are looking to put up shelters to keep the child there. It is only when the situation gets worse that they consult the social services. The reason why the policy was launched in the first place was that there was too much focus on the child than focusing on the child within a family. Okay. So the focus should have been families. So for instance, if a child is being abused in a home and a police officer goes or a social welfare officer goes, they are supposed to check out on the other family members to see who would be able to take the child on board, so that as Ghanaians and Africans, we've been groomed to live within a social context of the family and the community. But then here is a case, the scenario was they used to take the child. And so this policy was launched. But up to now, there is still some situations where some of the other units will still want to build shelters for children they pick up from the family, while social welfare would want to speak to families, negotiate with families, collaborate with families, so that the child will remain in the family. So what I'm saying is, even the second objective of coordination is not working. It means there is implementation problem.
So your problem is more of implementation rather than the policy
There is
deficiency.
another thing I wanted to pick up.
Okay, before you come to that, I'll have you brood over it a little bit. Let me bring in Dr. Beatrice, Dr. Gifty. Well, okay. Well, let me bring in the other doctor. and you understand that you've done some research into child violence. Tell us the result. What did you find?
Yeah, but before that, let me quickly talk about the gap.
Okay.
One gap that when we're having the national stakeholders meeting, one of our presenters talked about, which I thought is very necessary. The fact that they put all children, we know that the child is, the weakest and the most vulnerable in the family unit. And we know that in every national development, we cannot do without the family, right? So it's important that they were emphasizing the child and the family welfare, but they categorize all children like child without at least giving some room to the special children with special needs.
Okay.
Children with special needs, as the name suggests, they have different needs, right? But they didn't really make provisions for those children. Their special needs and how the various stakeholders will go about it. I think that is a key gap.
Another key gap.
Yeah, and then another thing is they mention various stakeholders, but it's about how to integrate their various roles. So we realize that there appears to be a clash because, for instance, they emphasize strengthening the community structures. And the community structures, for instance, we have the family, we have the churches, we have the traditional rulers, and all those. So if, for instance, a child is abused, now you have indicated in the policy, you have those key stakeholders. You have also indicated that you are strengthening. In fact, when you read the policy, they have given a lot of, focus, attention at to those at the community level. Now, how do the traditional rulers, for instance, address the issue differently from maybe the police? Do they report to the police or they deal it at their level? To the family? So that is some of the gaps that I have identified.
I see.
But with then coming back to my own question.
Before you answer that question, let me just quickly introduce another guest who's joining us for this discussion. He's Christopher Latte from the Ministry of Gender, Children and Social Protection. He will help us identify the solutions to the gaps that have been identified by GEMPA. Sir, thank you very much for your time this afternoon. You're welcome to the conversation.
Thank you very much, and a very good afternoon to you.
Right. Do hang on briefly, and let's listen to Dr. Jamara make her point about the research that you did.
Yeah.
What did you find?
You see, with the welfare, when we're talking about welfare, we are talking about how to enhance the psychological, physical, emotional development of the child, how to enhance the child's rights. And one thing that we hardly emphasize is sexual abuse of the child. And sexual abuse of the child is something that really affects. It has terrible effects on every aspect, dimension of the child. So we decided to do some research. But what I have here is initial findings.
Initial findings.
Yeah,
Tell us briefly about it.
Yeah, so initial findings, particularly what is most striking, for instance, is how, the first is the increasing, how, for instance, the cases of defilement. Increasing rates of
sexual abuse on children.
Defilement, particularly, on children. And how the cases are addressed. Those who are sent to court, those who are those who are arrested, those who are sent to court, and those who are convicted. right? But the sexual abuse, let me quickly explain this. When you're talking about the sex abuse, you know, when you're talking about child sex abuse, who is the child? A child is defined as an individual by the UN as an individual below the age of 18, right? And in Ghana, you know, we will distinguish between, of course, defilement and rape. When we're talking about defilement, is having the criminal act says that's having the sexual activity or carnal knowledge of an individual with or without the consent. Talking about the defilement is with or without the consent of an individual, of 16 years and below, right? And then rape is having a carnal knowledge with an individual without his consent who is above 16 years. So we can safely say that we can safely put defilement, both defilement and rape, under child abuse. Because those who are above 16 but who are below 18,
they're still children.
We can still categorize them as children. That is why I have here both the defilement and rape. And rape, right?
So you say, so one of the things that you found is that there's an increasing rate of sexual abuse against children.
Against children. Yeah, increasing, because when you look at, from 20...
No, I mean, we get that, we get that point. So unless there are other findings you want to share with us, let me quickly bring in Mr. Christopher Latte. Let me also indicate that we have Anton Yao Tete Brighton. He's a student from the Chimota School. He's a young man. He's a child by the definition of who children are. And he will also share with us what he wants to see from a ministry like the Gender and Social Protection Ministry that will make him as a Ghanaian child feel protected, because he doesn't seem to feel that way in the current policy as it is. Mr. Latte, we've been talking about, and I don't know if you followed it from the beginning, but we've been talking about certain gaps that these lecturers have identified in the family and child welfare policy. First of all, we know about lack of coordination. They say that the way that the document is presented, it appears that there's lack of coordination among these agencies that are supposed to protect children, that are supposed to protect families as well. There is so much focus on children without the necessary linkages to the families within which they exist. And then they say children are bundled up together. There is no clear clarification or distinction between between the kinds of children that we have. We have children with special needs, etc. Have you yourself, on hindsight, at the ministry, found any of these gaps? What are they?
Well, thank you very much once again. And good afternoon again to the panelists. Yes, concerning the lack of coordination, I would say yes, that there is some kind of a gap in there, because when it comes to rendering of service to children who fall victim of some of these abuses, there's supposed to be swift attention to the child to get the child out of that dangerous situation, and then the safety of the child ensured. As of now, the ministry is coming up with a one-stop center, which we have started the ministerial conversation. We met in Ho last year to look at the modalities, and now we are waiting for the ministers to now endorse. What is happening is that we want to set up this one-stop center so that anybody who is abused, and it's not even going to be only children, but the children are the most are the focus. When they are abused, they can call onto this service, this one-stop center, and then we will have a medical officer in there, a legal aid officer, we'll have a psychologist, we'll have a police officer, and then lastly a social worker. So these cohorts of professionals are going to take care of the child, take the initial evidence and all that, in order to be able to process the child to
I just want to be sure, Mr. Latte, whether or not this one-stop center you say the ministry is setting up is supposed to address the key and specific challenge of lack of coordination among the protection agencies.
Yes, as I mentioned, when it comes to abuse and the strictness of the service providers giving to the children who are victims of abuse, then this is what we are doing to bridge that gap.
Okay.
You see, we have levels of coordination, but in terms of this, that is what we want to do.
That is what you want to do.
Anybody who is victimized or who is abused can call on this center, and all these agencies will coordinate under one roof and make sure that the child gets the attention in record time.
Okay. And I see them nodding here, my experts here in the studio. I'm just going to take a very quick comment from them to find out if this works. And then we'll move on and we'll take the two other gaps that they say they've identified. Does this work for you? Let me talk. Yes. Let me come to you, Doctor.
Yes, I think if there should be any such one-stop, as he says, then it's going to be good.
Then it's going to be good.
But they need to monitor and make sure all the other units and agencies are brought together.
Working indeed
and
together.
They are working, they are coordinating activities and efforts and resources for the benefit of the child.
Okay.
And that is quite crucial.
Okay, Dr. Jama?
My point is, if they are bringing them here, I want to, I want them to really equip, enhance those people, their capacity. Because just as I was coming, I did a little, just annotated sort of interview with some of the traditional rulers, for instance. You know, though they are supposed to address some of this violence against children, of course, we recognize and appreciate their wisdom, I mean, their capacity and others. But I think there are times, there are certain areas they need to be, you know, enhanced.
They need some sort of capacitation.
Of course.
Capacity building in that area. So you can still have the people working together, but if they don't understand the terrain, they still won't be able to give you the. Dr. Sechua, you do have a point, but let me quickly go back to Mr. Latte so that we can get the responses to the concerns that you've raised in the
Actually, I wanted to add that.
Yeah, so that we'll come back to that. So, Mr. Latte, I'm coming back to you. It sounds like the one-stop center you're mentioning is a good idea, so they say. And even so, they're saying that there actually has to be monitoring to be sure that the people you have put together are not just put together for the sake of it, for the aesthetics, but that they're actually doing the job. And that whilst they're doing the job, they also have the capacity building that will that will help them understand the situation and appreciate it better. There are two other gaps they raised here. They said there's so much focus on children without necessarily focusing on these children within a family setup. So they are saying you want to protect the children, but you're not taking into cognizance the role of the family members, other family members in the lives of these children. Again, they say you bundle these children together and you say children, but there are children with special needs. There are other children under special circumstances. You don't provide any clarification in this particular policy. I'm sure you know this?
Yeah, exactly.
So how are we addressing it?
Yes. Let me start with what you just mentioned, the later one. Yes, this is a policy. And a policy is a statement which is being made concerning a particular group of people. So in this case, the Child and Family Welfare Policy, government is issuing out a statement concerning what it seeks to do for children 0 to 17 years old. When we were developing this policy, there were so many suggestions that we should include, indeed, portions to cover disability issues. Some also came with HIV, some came with the extremely, all these vulnerable groups came in. And this is not an action plan. This is a policy. Policies do not tackle the details of all the vulnerable groups to suggest ways of taking care of them.
Okay, so then what it gives me, the sense it gives me is that you do have another document from which
precisely what I was going to ask.
You do
there's
have
any signpost from the policy to tell us
what that's the question for you, Mr. Latte.
And what to check from where?
Is there anything like that?
Come again, please. I'm asking. Well, in terms of disability, we have.
No. Hold on. Just so we are clear that you got it right. You mentioned that the policy is not an action plan, and the question is whether or not out of this policy there is an action plan which provides these specifications. But these are experts in gender, issues, but they don't seem to know that this exists. Does it mean that you have not reached out to people like this with this information?
Well, the action plan is not part of the policy. The action plan is with the institutions that are supposed to be implementing the policy.
But
so when you go for all the institutions that are mentioned in the policy, we have done a examination, and we all even came together to come up with this action plan.
Okay.
So these institutions that are supposed to be rendering the services and doing whatever are already having copies of this action plan.
Okay.
Detailed action plan.
You were mentioning something about children with disability. I mean, children with special needs.
With the vulnerable groups who were not particularly covered in the policy, there are other documents or suggestions for other in-depth analysis of their situation and recommendations made. So, for instance, the children with disability, we have a Disability Act. That's an act of parliament. So there was no need to go in detail again.
Are you saying that the Disability Act should necessarily cover children? Because if you're dealing with children, then you want to just tackle it as children. But I think that Dr. Sechua has a question for you. I'll have her ask that question. You don't seem to agree with some of the things.
No, because you see, the policy is child and family welfare. So every child.
No, let's focus on the disability, the children with special needs.
Yeah,
okay.
That's what I'm coming
All
on.
right.
Every child in Ghana, including the disability, their name should have been written in here.
Okay,
now,
so it should have been clarified.
That's right.
Children
if
with
he's saying there's
disabilities.
another document, then there should have been an indication, a signpost, to tell us, we didn't put this here, but
it is
here.
there. Okay. Ms. Alati.
But what I'm trying to say is, a disabled child is a child in Ghana, whose needs must also be addressed by child and family
policy.
Welfare policy.
Ms. Alati.
Exactly. Sorry, I didn't get your name, but
her name is Dr. Sechua.
Dr. Sechua. Oh,
yeah.
good. Dr. Sechua, what is happening is that the child and family welfare policy is taking care of all children. It doesn't matter where you live or who you are or what is happening to you.
But Ms. Alati, the point that they're making is that if you say it is for all children, you don't treat all children the same, especially when there are others who have special needs. If they have special needs, you treat them differently. So, for example, in the UK, when you have children who have special needs, their parents, I don't know about the child policy so much, but the parents of children with special needs are treated special by the state in terms of benefits, etc. So what the point is that if you have children with special needs and you have a policy that is supposed to protect children and the family, it should be clarified in the policy that this is for children with special needs.
I think this is a huge gap.
Yeah.
All right, I get your point, but I also well noted.
Well noted. Well noted. That was that's the word I actually said in my head for you. Well noted. But noting it is not enough. What is the ministry going to do going forward about this?
Yes. I mentioned earlier. Government as a whole, the government machinery, is seeing this whole child protection, child welfare issues as one.
Okay.
So what Ministry of Education is doing, Ministry of Health, the Ministry of Gender, we see everything as one. And in the same way, what Ministry of Labor and all other ministries are doing is an effort to enhance and protect children in general. Yes. So as I mentioned earlier, we have taken notice of this. In operational plan, we have outlined measures. And even yesterday, when His Excellency the President was speaking about disability things, he mentioned that it has been increased from 2% to 3%.
Okay.
And then, I mean, it's a whole government machinery. So we are...
Yes, it is. Yes, it is. But again, the disability, the older persons, their concerns and the issues around them is really, honestly, different from the issues and the ones that confront children. And I think that this is very good feedback. This is work that these doctors have done. Is very good basis for you to begin to look into this to make this policy better. But hold on for me, Ms. Alati. I have a child joining us. He's going to join this conversation. He's also seen the policy. He has his own thoughts about this policy. Anthony Yao Tete Brighton is a Form 3 student from the Achimota Senior High School. Anthony, you've seen the policy. You have some thoughts on this. Share with us. You have the ministry's ears.
Yes. I've read through the policy and it seems to support cater for a lot of children in the family, but then my question is, it's called the Child and Family Welfare Policy, but then prior to the program we had at GIMPA on Tuesday, I had never heard of it, only to even realize that this is a reformation of a previous policy.
Wow. Right.
I had never heard of this policy before.
Okay.
Neither on TV, news, nowhere.
Okay. So let me put this to the ministry. And Mr. Lasse, this is a very interesting question, trust me. He says that, now he's a child, he goes for a meeting and hears about a child and family policy. He has never heard about it. And to add to that, he's told that this is actually a reformed policy. So there's one that existed way before this one. And he is a 17-year-old boy. In his entire 17 years of existence in this country, he's never heard of this.
Well, that is likely to happen in the sense that there are so many policies that not everybody knows about.
That is a total failure, don't you agree?
A huge gap.
Oh, no.
It's a total failure when the policy is about me and the policy you are making to protect me is unknown to me.
You see, and if you say total failure, that's why I don't agree with you.
Okay.
It is on the internet, okay? We have uploaded it on the net. You just Google child and family welfare policy. You see it. What is needed to do? Reading the document will not be beneficial if the services on the ground are not there. So the policy is supposed to guide policy makers, policy implementers, and then I agree the children themselves to know. But we cannot cover the whole country all at once. This thing was launched in 2015.
Okay.
We have been making efforts. We've gone region by region to disseminate. We've gathered children to talk about, to them about about the policy. And again, there are campaigns going on, the Gaga campaign and all that, all in the effort to make people know some of these things.
Right.
But it is so possible. I mean,
it is so possible, Mr. Latte. It is so possible. It's not what the Ghanaian child wants to hear about what the ministry is doing about their protection. So let's be more, proactive. Let's be more forward-looking.
Yeah,
and by doing that, the question is, what is the plan to make sure? And this is not a student in Brahabe Bumi Senior High School. This is a student in Achimota, right here in the heart of the city. And they don't know. And indeed, Achimota is known to be one of the elitist schools. So if the students in Achimota do not know this, I don't know what the students in my hometown will know. So what is the strategy, Mr. Latte, to make sure that children who this policy is about know, the families know about it? I'll have you brood over that, and I'll take another concern or another thought or expectation from Anton again. Anton.
Yes.
Yes. Go ahead and tell us what your expectations are.
Child and family welfare policy. I'm expecting this policy to cater for the everyday Kofi begging by the roadside at the traffic junction and the everyday Ama selling pure water at the harbor day in, day out, because they don't know about this. They don't know that they are supposed to be in school. They don't know that their needs are supposed to be met. They don't know that men they don't even know shouldn't be touching them in inappropriate ways. Yeah. So I'm expecting this policy to cater for them, because obviously the children that are in catered for homes and big schools, they will be cared for by their parents and by the institutions. But then the everyday children that come from impoverished homes, their fathers are either not around or their mothers are always busy. They don't know any better. They don't know that everything that they need should be provided for them. They shouldn't be abused. They should be in schools. They don't know. So I'm expecting this policy to really cater for them.
Okay.
Actually.
How do you want, Mr. Latte is going to tell us about the strategy, what they think. I mean, if they've not thought about it now thanks to you and from the lecturers from GIMPA, we've raised this issue with them. Maybe they're going to do something about it. And indeed, they should. So Mr. Latte will tell us what exactly they plan to do about it. But let me ask you again, Anton, how do you want this information spread?
Yes.
How do you want this information to be made accessible to people your age and even those you're older than?
Well, among my age bracket, social media is a thing. It's very, very efficient in spreading information. So it should be made aware. Schools, morning assemblies, announcements, such things should be made public in the newspapers, teenage newspapers, social media, WhatsApp, Instagram, Facebook. Such things should be propagated because people my age and a bit older and a bit younger, almost everyone has a phone these days, and almost everyone is on their phone constantly. So it will make more sense that this policy is propagated through such media where there's a high probability that they will chance upon it or a friend of theirs will chance upon it and send it to them.
Very well, very well, very well. This is deep. Mr. Latte, this is free consultation for you we're doing here. I'll bring my invoice later, but do share with us what is your strategy now. I don't know if there is already one as far as dissemination of this policy is concerned, but right now we're speaking about it. Free information as well, we're providing the ministry. What is going to happen from now?
Yes, we will continue to do our dissemination, and as the gentleman mentioned, there are a lot of campaigns going on. You know, we are taking bits and pieces of this policy, and we are highlighting on the need for everybody to know. The Ghanaians Against Child Abuse is one. It actually was born as a result of this policy.
Okay.
To stop child abuse, and there are billboards everywhere. There are.
I've seen the billboards. I've seen the billboards. The children want to have this on their phones, on social media. They want to see it closer.
With the social media, I think we will take it up and then we'll start with that.
Okay, sounds good. I'm going to take final comments from all of us doing this. And Anton, I'll give you the very final word. So prepare for that for me. Let me start the final words from you, Dr. Sechua.
Right. I think one thing I also want to raise, maybe being my final whatever, is the fact that the policy itself, at the moment, started off as a pilot program.
Okay.
And it is still the case. They've not gone back to revisit to see whether it's worked and whether piloting it was successful or not.
Okay.
And whether they need to do it for the whole country. Okay. I was shocked to hear that it was still at the pilot stage since they launched it in 2015.
So you want the ministry to go back?
I think that's a huge gap that the ministry need to correct.
Okay.
If we will see the impact, the positive impact at all about the policy.
Okay. I'm sure Mr. Latte is taking some notes there. Yeah. Let me come to you, Dr. Jamara.
I would say that the child and family welfare policy should not be taken like any ordinary policy, because, as I said initially, the family is the key unit, the critical, I would say, even the most important unit in society. And society depends on this policy, so it should not be taken for granted. And as the guy was saying, people should know what is there, what it entails. And particularly, I said, unfortunately, I didn't have time to really expatiate, talk about this child sex abuse.
Yeah.
Because it's something
I think that's a whole, it's a whole debate, conversation on its own. And we can make space for that another time. We certainly
because it's something that it's trivialized in society. We hardly talk about it. Talking about prevention, even talking about the social media. Look, many of these friends are using the social media for other negative things. But we could, and that is really even enhancing this sex abuse.
Okay. So wrap up for me. So you're wrapping
up. What I would say, I wanted to, there's the Royal Highness Princess Lala Mariam in Morocco said something that I like so much, because anytime we are talking about, you know, development, and now the key word is sustainability and those kind of, we look at how the world we're going to live to the next generation.
Right.
But he says that what matters in the world most, and what matters is not the world we leave to our children, but rather the children we leave to the world. And I think that that is something very important that we should look at. When we are emphasizing this, we are not, it's important what we leave for the children, but we should also think about the children we leave for the world.
Okay, Dr. Sechua, you wanted to add something quick. We really ran out of time, but I'll allow a few seconds so you can add it.
What I was going to say is that the coordination bit needs to be well taken. I know he's promised that they are going to work on it. So we would like to see in the future that all the units are working together, and that everyone is doing their best to push this policy, as Dr. Jamara just said, It is not any ordinary policy. It is a policy that needs to be taken seriously because the children are the foundation of this country. And if we are not going to be looking after them, looking at the abuses going on right now in Ghana, including Sakawa and Galamsey and all those things that take children from the classroom and makes them die at a very prime age, we need to check out as a country and wake up to the faith of these young ones.
Okay, Ms. Alate, I'm coming to you before I go to Anton because I want to give him the final word. He's a child in this conversation, so we'll give him the final word. Ms. Alate, you've heard all these concerns, and I'm sure that you're taking notes because I think this is very helpful information, research information that has come to you. We just dropped it on your lap like that. So tell us your final words.
Yes, just to respond to what was earlier stated that the policy is being implemented in only 20 pilot districts. The fact of the matter is that, yes, we are piloting aspects of the implementation. There was a capacity building of the actors involved in the 20 districts. Implementation is nationwide, but we wanted to pilot that aspect of the capacity building of the stakeholders involved, that's the actors, the government actors, to see how best they will respond and then what the need will be. 5
years, I'm told. You've been piloting this for 5 years?
No. Should it be? No, it's a project. So we finished last year.
Okay.
We finished that last year.
Okay.
And the report is now ready for replication in other regions.
Okay.
But indeed, we have, the implementation is everywhere in the country.
Right.
Yeah.
Right. So hopefully we'll be hearing from you a lot more on this, and trust me that we'll come back to you. We will raise this conversation once
Always
again.
Available.
Right, but before you go, I want you to listen to Anton. He's our final. He's got a final take in this conversation. Anton, take it away.
Yes.
Your final word.
This policy, I would plead that this policy be taken. Yes, I would plead that this policy would be taken very seriously by, the governments, the public, the movers and shakers in everyday society, the people whose words matter. Because the children that are being brought up today and being abused will end up being our leaders for tomorrow. And if nothing is put in place to protect them such that their future is guaranteed and they will make Ghana a better place for the future generations, then it's a very sad state we'll be in. So I plead that this policy be taken very serious and implemented as much as possible in all areas in society, schools, hospitals. The everyday person by the roadside should know about it and be able to explain it to his neighbor.
Okay. Do you feel comfortable? Do you feel that this conversation has helped or will be helpful in any way?
Yes, I feel like this conversation has clarified a lot of things.
Anton, thank you very much. So I've been having this conversation with Dr. Gifty Jamra. She's lecturer at GIMPA and a gender expert. Also, Dr. Beatrice Ekia Sechua. She's coordinator of the GIMPA Gender Center. Thank you very much, ladies, for coming. Joining us over the phone was Christopher Latte from the Ministry of Gender, Children and Social Protection. He is the Senior Programs Officer there. And also joining us via live view was Anton Yao. Tete Bryson is a Form 3 student from the Achimota Senior High School. We'll continue this conversation someday, certainly. As long as there are children to be protected, as long as there are families to be protected, we'll continue this conversation.